So central line dressing changes need to be done weekly. And when you're ready to do a dressing change, it's important to prepare your area. Get the room ready, clean your working surface, and in home care sometimes we have to make do with what we have. We can't always have everything above waist height, which I know you're taught in nursing school, but make sure that you can control whatever is possible. So close the windows, turn the fan off, make sure the pets are locked out of the room. Small children, if possible, should be out of the area as well. If your client has a tracheostomy, you'll have to make sure that you have a second person who is available to suction if that's needed during the procedure. And if so, then the second mask will be for your helper. So when you're ready for the dressing change, you want to gather your supplies. You'll need a dressing change kit. You'll need clean gloves. Then you'll want to have some way to wash your hands after you take off the old dressing. So I've already started by washing my hands. And now I'm going to open the dressing change kit, being careful not to contaminate the inside of the packaging. I'm going to remove the mask from inside of the package, and with this particular kit there are two masks. There are some kits that come with only one, but if there are two masks, one would be for your patient or again for your assistant, and then the second mask would be for yourself. So I'm going to put on my gloves. So I'm ready to remove the old dressing. So removing a tegaderm dressing from human skin is a little bit different than removing it from the mannequin. One good technique is to grasp the corner, and we'll pretend that she's got a line coming out right here. I would want to stabilize the insertion site for that line. And then if I grab the corner and I stretch flat against the skin, the dressing will release. And we want to do that instead of pulling it up. That will be more damaging to the skin. So I'm going to stretch and release, and I want to do this working from the bottom up so that I'm not going to compromise the catheter site. So again, I'm stretching to release the dressing. So if this is my insertion site here in the center, again, I'm stabilizing that. And at that point, it should be released from the line. So I'll don my sterile gloves. Picking up the first glove by the cuff. With the second glove, I'll slide my fingers underneath the cuff and keep my thumb out of the way. Then I'm going to set up my sterile field. The shiny side is going to go down. Make sure you take a look at what's in your particular package. This has a ChlorPrep swab stick. The instructions for this stick are included, and it's not a bad idea to take a look at that to make sure that you have the right information. So this particular stick I have to scrub for 30 seconds and then allow it to completely dry for up to 3 minutes. This is an iodine ointment which needs to be left on the skin in order to work properly. So you would use this for clients who are sensitive to ChloraPrep. So I don't need it for this client. Okay, I'm ready to begin. I'm going to use the gauze 2x2 to hold the line. I'm going to crack the ChloraPrep stick, and then I'm going to scrub for 30 seconds. It's using back and forth strokes, not using a bullseye or anything. Friction is what gets this clean. Some kits have different components. If they have an alcohol wipe in the kit, you would use the alcohol wipe to scrub the line itself. If you don't have an alcohol wipe included, you can use the ChloraPrep to gently scrub the line. But just know that ChloraPrep does dry a little bit sticky, so there is a risk that the line will get more easily stuck to the dressing. After you've scrubbed for 30 seconds, you need to allow the site to dry, again in this case for 3 minutes. During that 3 minutes, you can't fan the site, you don't want to use anything to dry it off, you need to just wait for it to dry. For our purposes in class here today, please go ahead and use the 2x2 to dry it off, just in the interest of time, but again, you would not dry this off on your client. Also included in the kit is a skin prep wipe. Again, this is one that we will not use in class here today, but the way that this works for your client, once the ChloraPrep is dry, you can go ahead and use the skin prep wipe to just cover the area where the dressing will sit and allow that to dry as well. Once that's dry, you're ready to place your dressing. It's important to center the insertion site in the middle of the dressing. It doesn't matter which way you turn it as long as the insertion site is in the center. And you also want to make sure that you're not stretching the tegaderm when you place it down. Place the tegaderm on the site and then remove the outer border, making sure that all the edges are stuck down. I want to save this outer border because there's a sticker here, which I can use once I'm finished to label with my initials and the date of the dressing change. And again, a dressing change is done every 7 days. Once the dressing is in place, I can go ahead and remove my mask and remove my gloves now that the insertion site is covered. And I can wash my hands. And then I'm ready to tape the edge of the dressing. You'll notice here that if I pull up on the line, it'll pull up on the edge of the tegaderm. So I want to secure that bottom edge of the line. So I'm going to do that by taking a piece of tape, tearing it halfway through. Then I'm going to put it underneath the line up onto the edge of the tegaderm. I'm going to take another piece of tape, do the same thing, tear it halfway through. Then I'm going to put it over the top of the line, again on the edge of the tegaderm. That way I've secured the line from the top and from the bottom so that if I pull up on it a little bit, the edge of the tegaderm is secure. Again, I would get my pen at this point and label the dressing with my initials and today's date. And then I'll complete my assessment of the site. So my assessment of the site includes the integrity of the insertion point and the surrounding skin. Is there any warmth, redness, or drainage? I'm going to measure the length of the line from the insertion site using centimeters. And this particular line has a little black mark here that I can see. So this line is 8.5 centimeters measured from the insertion site to that pre-measured point. 8.5 centimeters, I'll document that, along with the fact that I completed a dressing change today, and how my client tolerated the procedure.